Hi, I'm Dr. Zen from Zen Health Center. Today I'm going to talk to you about shoulder problem. The reason that I'm bringing up shoulder problem is that most people don't realize how prevalent it is. And recently I had a elderly lady who had only side flexion, lateral flexion only of 25 degrees. But after the treatment she was able to raise double the range of motion. Acute or chronic. So what happened with acute syndrome is people who slip and fall and have their hand reach out and they fell on their hand, and that's caused a injury and trauma to the shoulder itself. But more common than other for shoulder problem is a chronic injury. Chronic injury come from sport activities such as throwing softballs, throwing baseball, playing basketball, even swimming, believe it or not. And besides the sport-related repetitive injury, what are even more common are affecting majority of people are people's slouching posture. With the slouch posture, what happens is that our shoulder go into internal rotation, and that causes the joint to be shifted out of proper alignment, and every time they raise their arm or do any activity, they're actually causing micro trauma. What I do in treatment, of course, to find out where the injury is coming from, and so typically there are scar tissue that cause adhesion, which limited how far the shoulder is able to move frontal and sideways. And I need to go in to physically break up the scar tissue. We'll put heat and electrical steam to loosen up the area, as well as doing adjustment to the neck area and the shoulder area to allow the electrical impulse to be conducted normally. Try to avoid the activity that bothers them. So avoid sleeping on the side, and if they are throwing baseball or doing lifting overhead or pulling down overhead, try to avoid such activity, and when it's bothering you, you can apply ice to the area. If you have shoulder pain, don't suffer. Come in to see me.